Hey everybody, Katie here from Front Porch Nurse. If we have not met, hello, registered nurse, over 20 years in nursing. I love to educate, and it's something that nurses don't get enough time to do. We know a lot about what could help people with their health, and we don't have very many chances to tell people. So here I am. I want to talk briefly about chronic disease today. Let's define it, let's talk about it for a minute, and let's talk about what you could do to help yourself. As a Gen Xer, you probably have a diagnosis of a chronic disease or you're flirting with it. Like maybe your labs or your vital signs are a little bit off, but you haven't been diagnosed officially yet. Chronic diseases are things that last a few months or more. A lot of the time, they're considered like a diagnosis for the rest of your life. Um, for example, like asthma. Once you have asthma, it can, I don't know if I want to say it can go away, but you can control it with lifestyle. If it's bad, medication and lifestyle changes. Um, but it won't necessarily ever be completely out of your body. Does that make sense? So, a lot of chronic diseases, let me give you a list of examples: diabetes, high blood pressure, high cholesterol, COPD, it's a lung disease, asthma, migraines, cancer is considered a chronic disease, dementia is considered a chronic disease. What else? Arthritis, the autoimmune diseases, which women, especially our age, suffer from a lot. And there are a few things we can do about it. So, I'm sure that our healthcare system is not that good at managing chronic disease. They're really good if you just want to take a pill. That's fine. But in terms of educating us and helping us make changes, because lifestyle change is the best way to manage a chronic disease. So, like changing your diet, maybe eliminating whatever, dairy, gluten, you've heard it. Um, Getting more physical activity, like in asthma or allergies, avoiding triggers. If you know you're super allergic to cats, maybe don't get a cat. I'm sorry, pets are, I know. Um, you know what really is really hard on us women, especially, is stress. Stress exacerbates all of our chronic disease symptoms. And the reason why is because ongoing stress, which is actually called chronic stress, um, promotes inflammation in the body because our body always thinks it's fighting for its life. It always thinks, oh shit, there's a tiger and I'm going to be dead. And so our body floods itself with these stress hormones and chemicals, and we are always getting inflammation. You might notice this in your joints in middle age. Arthritis is actually a chronic disease, also. So, what do we do? And just so you know, about 60% of people in America have at least one chronic disease. 40% of people in America have two or more chronic diseases. Your aging parents probably have at least one chronic diagnosis, and most likely they take medication for it. High blood pressure, super common, high cholesterol. Um, so, what do you do? Okay, first of all, know your numbers. Like if if you have high blood pressure, know what your blood pressure runs when you're super stressed and when you're not stressed. Know what your blood pressure runs on an average day. If you take medication for it, know how much that changes your blood pressure. These are all important data points, and someone should be watching this for you, but it never hurts for you to watch it yourself too. Advocate for yourself, know your body. Um, get regular checkups on this stuff. If you ask, hey, like say you're getting a new diagnosis for a chronic disease and you say, hey, I really don't want to take medication for this. What else could I do? Or what could I try first? And then they will tell you, oh, well, if you eat this certain way, this should help. Or if you do more aerobic activity, that should help, or whatever. I don't know why we have to ask. Well, I do know why, because everybody's so busy. Our system is based on caring for sick people, not keeping people well. But anyway, ask. Know your numbers, ask. What else? What else? As much as you can, prioritize getting decent sleep at night, which gets harder as we get into middle age, doesn't it? And if we have worries and stress, yes, I know, but try. And there are a lot of things you can do for yourself to relieve that stress. So we're going to get more into that in other videos. Basic, super basic, take 3 deep breaths. Stop. Take 3 deep breaths. Right there, you have helped your body's physiology. Yeah, like that. Okay. So we're going to keep talking about this. Now is the time, people. Now is the time to do something about this, because you may be looking at your aging parents or other older folks and thinking, eh, I really don't want to go down that way. Now's the time. You deserve to prioritize yourself. You don't owe anybody else your health. You owe yourself your health. And we definitely are going to talk more about how to fit these things in. But for real, things like 3 deep breaths, those things work. They have been measured. Okay? So that's chronic disease. It's a bitch. We pretty much all have it. But my dad used to say, well, it's better than the alternative. Yes, true. All right. Subscribe. What other options do you have? Like, share. Come on over and join my email list. And thanks so much. Talk to you soon.